Good evening. Hello, this is Mayor Baraka. I just want to thank you once again for tuning in to our COVID-19 update. Today we have Dr. Sharif Elmahal, President and CEO of University Hospital, joining us on the line to give an update. Before he does that, I do want to share that as of today, we have 78 confirmed cases in Newark, 342 in Essex County, and 3,675 in New Jersey. New Jersey is slowly growing in the numbers, and it looks like we're going to be the second state with the most cases positive of coronavirus. Dr. Elmahal, welcome and thank you for your time and being on the line with the residents of this town. The floor is open to you, sir.
Thank you so much, Mayor. First of all, I want to thank you for allowing me to appear on your daily coronavirus update. We are grateful for your leadership in the city of Newark at this difficult time, and I think everyone can agree that you have done your best to keep the public informed at every single step. Likewise, I wanted to give you and the public an update on where we stand at University Hospital as we tackle this ongoing public health crisis. As of this morning, we had 7 patients at University Hospital who have a confirmed COVID-19 diagnosis and 38 patients who are under investigation. As the only level 1 trauma facility in northern New Jersey, we are uniquely qualified and experienced to take on this challenge. I am so incredibly proud of our frontline clinicians and staff who have been literally working every day and night for months to make sure that we are ready for the surge of patients that are expected due to this COVID-19 outbreak. However, while at University Hospital, we are ready and willing to take on this fight. All hospitals have a finite amount of resources, especially as the number of people potentially infected grows, which is why it is so critical that people listen to Mayor Baraka and stay home. Only by limiting our exposure to each other and the community can we slow down the spread of this virus and flatten the curve. Please stay home and allow the frontline professionals to do their job. I want to end my update by just saying that I am deeply moved by the incredible acts of generosity, both large and small, in our community during this difficult time. Last week, an anonymous corporate donor gave more than $2.2 million to our University Hospital Foundation, specifically to support our COVID-19 efforts. And since then, individuals and corporations based here in Newark have stepped up to make donations of PPE and other critical supplies. We also have gotten free food delivered for our staff on the night shift who are working to access any other food is extremely limited. And we've got a large donation of candy from a corporation based right here in Newark. We may be healthcare providers, but that doesn't mean we don't appreciate a good candy bar at a time like this. University Hospital is proud to be Newark's hospital, and never more so than now.
Wow. Thank you, Dr. Elmahal. Thank you for all of the healthcare providers, the frontline folks at University Hospital doing an awesome job. We are incredibly happy to partner with you and the great things that you're doing over there. Thanks for taking the time. Today, I have more information about food distribution that I wanted to talk about. Beginning this Thursday, we'll have a phone number that you can call. Beginning this Thursday, so you can't call until Thursday. We have a phone number for you to call. We will be giving you a gift card, but we will be shopping for you, so you do not have to come out the house. The number is going to be 973-733-5728. 973-733-5728. That is if you are eligible, meaning that you do not have the financial wherewithal to get food in your home, or if you are a senior. Obviously, we only have a limited amount of cards at first. As more resources come in, we're going to get more and more cards. So we are obviously going to focus on seniors and those who need it the most. When you call, please be prepared. They're going to ask you a few questions. They're going to ask you a few questions to see if you, in fact, qualify. You can call, again, 973-733-5728. between the hours of 9 a.m. and 5 p.m. to make your order, and then we'll go and get it and bring it to your home. But do not call until Thursday. We'll have shopping coordinators at ShopRite who will do this work for you. We also want to thank the National Action Network, the Newark Housing Authority, Neil Greenstein from ShopRite for partnering with us to make sure we can get the food to those who need it the most in our city. Remember, Thursday, 9 to 5 only, can you call. Next, to follow up on our residents without addresses. Obviously, we've secured short-term rapid rental housing and aid for immediate housing for persons in need. We created locations throughout Newark and are not concentrated in one area. We will provide on-site staffing, medical services, and food for them while they stay there. And we anticipate that about a little over 200 rooms we will have to assist our residents without addresses at this time. And we'll begin to secure more space as we go. And as things tighten up, we'll begin to share more details for you. I just want to reiterate something that Dr. Elmer Hall said, that people should in fact shelter in place. And what you don't understand is when you contract the virus and you spread it to other people, you're putting a burden on the healthcare system. They have to treat you as you come to the hospital, hundreds of people who think they have it, who might have it, and those who actually do with the limited resources that they have, and still continue to treat folks who in our community have other ailments, unfortunately disproportionately higher than other communities. Whether you're talking about heart disease, diabetes, all kinds of high blood pressure, all kinds of other diseases and ailments that we have, that we still have, that we have to be treated for, and makes us more vulnerable in these situations as it relates to COVID-19. There are testing, and I want to reiterate what was said yesterday. We're testing at the FQHC, and soon you'll see a tent be erected in the South Ward in the park in Newark that'll be guided by the county with help from the state and us here in the city of Newark. You can't just drive up there and get tested. You have to go through a process, meaning there'll be a site you go to online, you tell the folks your symptoms, and they'll give you an appointment to drive up. And this is probably for people who are really sick. There are a whole bunch of us who think we're sick, who came into contact with people who we believe are sick. The thing that you should do is stay in your house, shelter in place for 14 days or more. If your symptoms or your quality of life deteriorates, then you should contact your healthcare provider and then go to the hospital or follow their directions, whatever it is. But folks that are going to the drive-through testing will have an appointment. If you don't have an appointment, you should not be in the line. People that are going to our FQHCs are going because they also have an appointment. If you do not have an appointment, then you should not stand in line. We have very, very, very limited amount of resources throughout the state of New Jersey. A good thing to do is reach out to your federal delegation again. Reach out to the president of this country. Tell them we need resources. We need tests. We need masks. We need gloves. We need ventilators. We need all of those things. It's impossible for us to provide the service that we need for the residents of our city and in the state without the things from the federal government. We need that, and we need it immediately. In any other corporations, like I said yesterday, thank those who have been helping, and those who have not helped. It's time for you to get on board and help and support what's happening in this city. We need you to help us to make sure that our community is safe. Listen, business can't function unless the community is safe and healthy. It's important for us to note that and understand that clearly. I do want to say also about the fact that people have tested positive. We said that there are 78 people in the city of Newark that tested positive for the coronavirus. Now, there are folks that I've been getting communications about who have been going back and forth with our people trying to figure out where these people are. If there are people in your building, does your building have the responsibility to tell you? Should the city tell you? And the answer to that is no. The HIPAA laws are very, very, very clear. The information that you know about people who have contracted the virus, they have voluntarily given that information. When you see these basketball players or these athletes or these movie stars saying they've contracted the virus, they've given that information voluntarily. Folks in these other places that you see on TV, they've given that information, or their family have given that information. We do not have the authority to give you information on individuals that have tested positive on your block, in your building, that live next to you. In some cases, it'll have a negative and adverse effect on those people's lives and on your quality of life. So let me tell you what the process is. Once somebody is confirmed, because there will be people being quarantined who are in fact not confirmed. The test can come out negative. And if we tell you that, then we put an undue stigma on this person and in that building, and they could just basically have the flu or a cold or an allergy. Once the person is confirmed, the health department monitors these people, and they have to shelter in place. They can't come outside at all. They shelter in place for 14 days or until they get an all clear from the health department that they can in fact leave their facility. If their health deteriorates, they will be taken to or be told to come to a healthcare facility or a hospital. They're not allowed out of their home. So you should not be in danger. If someone does leave their home, those persons' address information are given to the local authorities. The local authorities then take over the police, and we begin to find that person. If the situation is so bad that we need to inform specific people, then those people will be informed. We cannot turn this into a witch hunt of individuals. What you should be doing anyway is washing your hands, staying in the house, not coming outside unless it's an emergency or necessary. That's what you should be doing. You should be cleaning down your surfaces. You should not be in crowds of 5 people or more. You should practice social distancing, remaining 5 to 6 feet away from people at all times. You should not be in crowds, right? You should wear gloves if you need to. If you're touching elevators or door handles, you should be wiping them down or wearing gloves when you do so. That's what you should do to protect yourself, to protect your family. Even if you found out the names of individuals, that's not going to make you any safer than you are if you do not do these things. Do the things that the health care professionals are telling us to do, and you have a greater chance of being healthy and being safe. But if you are outside, then you are reducing your probability of not catching this virus. In fact, the numbers in Newark are growing, and they're growing fast. Tomorrow, I will be making another declaration at 5 p.m. First, I will have some good news about businesses, about finances that we're going to make available to businesses. I'll have some good news regarding employees or what we call hourly wage workers that have been laid off or have no work to go to. But after that, after we assess the numbers that the public health officers in our city have given me, we'll make a determination about whether we're going to expand those zones either a little bit or significantly. It's important for you to tune in tomorrow so you can know what the further instructions are. Because obviously, people have not listened to the first thing. And I don't want to say everybody, because the majority of us have been listening, but there have been a few of us who have not. You should not be visiting relatives. You should not be running in the park with 5 or 6 people. You should not be going to events. You should not be at church. You should not be crowded in the store. You should not be hanging in front of a store. You should not be catching an Uber to hang in front of a store with other people. You should not be on the stoop with a bunch of folks. You should not be having dinner parties. You should not be having any parties of any kind. If you're having these things, then you are in fact making it more dangerous, not just for the people of this community, but making it more dangerous for the healthcare providers and the health system that has to treat the people who are coming to the hospital who are in fact sick. And you may be taking this home to people in your family who do not have an immune system as strong as your own. So tomorrow at 5 p.m., I will be making an announcement about whether we are expanding these hot zone borders exponentially or in a smaller way. And that will depend on the mapping and the numbers and what the information that I get from our healthcare officials here in our city and the Greater Newark Health Coalition in and around this area. If you're from a surrounding city, from Irvington, East Orange, Orange, Hillside, South Orange, Montclair, listen, we love you. We shop and hang out in those communities. You're a sister city to us in Newark. We know that our city couldn't function the way it functions without you. We are asking you, because we have a curfew in Newark. Our curfew begins at 8 p.m. We have a curfew that begins at 8 p.m. I'm asking you to honor our curfew in our city and stay out of Newark after 8 p.m. Now, when this curfew is done and we back to normal, we gladly invite you to come hang out and party and eat at our restaurants and take part of all of the things that we have. Go to NJ Pack, Prudential Center. But today is not that day. We need you to be home at your house because the people in Newark have been instructed to stay home at their house. So that being said, listen, I know it's hard. And you're getting a bunch of mixed messages from me, the state, the federal government, Governor Cuomo in New York. Everybody's saying all kinds of things. The key thing is that we have to practice social distancing, and our life has changed, and it's changed for a while. I know the president is saying that by Easter, we should all go back to normal. I pray to God that he's correct, but we have no evidence, no proof, no knowledge of that at all. I do not want you to believe that that is in fact the case. You need to follow the instructions that you've been given here locally and protect our communities, protect our families, protect our city. Prayerfully, somebody of a higher authority and a higher power steps in, that's even higher than our president, and tells us that Easter is the day. If Easter is the day, God bless us all. But until then, we have to practice the things that we're telling you to practice and continue to do so. It's a rough time, it's a difficult time, but we'll get through it. I promise you we'll get through it. We won't get through it without any bruises, without any mistakes, without falling down, without a few people hurt. And even, unfortunately, some of us are losing their lives in this process. But we're going to get through this. I don't know if it's today, tomorrow, or Easter, or sometime after then, but I know we will. We just have to do it together, stay focused, stay unified, follow instructions, and take care of our families. Godspeed.